Good afternoon. My name is Kristina Quinones. I am the military practice liaison at Katie's Way Plus at the El Paso location. So of course we are located right off of Woodrow Bean, the Woodrow Bean exit in the northeast area. And this is just our contact information. So a little bit of background about Katie's Way Plus, who we are, why we were founded, and who we were founded by, right? So our CEO is Jeff Mathis. The name Katie comes from his daughter. Katie, unfortunately, took her own life because she was seeking behavioral health services and she could not receive them in time. But due to his tragedy and his loss, of course, we now carry on Katie's legacy through our work that we do at the clinics, right? If you look in the upper left-hand corner, that is our original logo, that is Katie's Way. And then our board members are all comprised of generals, like from military experience. So they have their military experience, right? So due to that, they saw the need to expand into the military community and provide what we can provide to them as well. So just helping them in that aspect, which is why now if you look in the upper right corner, we are now Katie's Way Plus. But I want to emphasize that we do provide services to both the civilian and the military community, because a lot of people think we are only military exclusive. So just a little bit about our mission, vision, and our goal. So our mission is to, of course, provide world-class behavioral health care to the military and civilian community through the services that we provide. Our vision is to revolutionize mental health care, and we're able to do that through a treatment method called Deep Transcranial Magnetic Stimulation, which we will get into in the following slides. And our goal is to, of course, foster resilience, promote healing, and just improve the quality of life for everybody that walks through our doors. So this is just some of our current locations and hopefully coming soon locations. So right now we are placed close to major military installations. If you look, we have one location here in El Paso right now, but we are hoping to eventually expand within, hopefully by the end of this year or beginning of the next, to have a second location. But we also have locations in Colorado, Alaska, Washington, the list goes on, and then of course coming soon. So this is just an overview of our services. I explained to you a little bit about it when we were over there, but we do an initial evaluation diagnosis. Patients do not need to have the diagnosis before they come into our clinic. We're able to do the diagnosis here. So when patients come in, they will do the intake assessment, like I explained over there. We will do, based off your initial evaluation diagnosis, we will come up with a treatment plan. So which avenue works best, right? Do you want to do therapy? Do you want to do medication management? Or are you a good candidate for the deep TMS, and can we start with the TMS? A lot of our patients can do one service, or they can do all three, because it's completely safe and actually helps if you combine all three together. Medication management, we went over that. Telepsychiatry, psychotherapy, and neurostimulation. The neurostimulation is the TMS, but I think I went over it already. But also we do have the capability to do telehealth services as well. So if they aren't able to come in person, the only thing we do ask is for their first initial appointment, they do come in person so that we can assess their needs and go on from there. But if we feel like they are good to go for telehealth services, we will accommodate that, of course. And now that we went over the backstory of why we were founded and our reason, our purpose, our why, it's highly important that we emphasize the same-day walk-in appointments, because if you need the mental health care, you should not have to wait months or however long you do have to wait to receive those services, right? Because some people don't have that time to wait.
I love that, by the way, because even my experience here, I was like, hey, I have insurance. I want to go ahead and check into a therapist, and it's amazing how long you got to wait.
Yes.
That really isn't an issue. So that's really an incredible point right there.
Yes, and so I don't think I mentioned it, but I recently transitioned out of the military almost 4 months ago. So when I was in, I experienced firsthand, the wait times and trying to seek that help. I was fortunate enough to get the help that I needed, but I know that there are some who weren't able to, or they have to wait in between their appointments, and we're serving, and there's a lot of things that are going on. So being able to support the mission, but also you have to take care of yourself. I always say you can't take care of anyone or anything else until you take care of yourself. That's exactly why we're here for. So just a little bit of background behind Deep TMS. Again, it's Deep Transcranial Magnetic Stimulation. So what it is, I say it is a non-traditional treatment method, because typically I call the traditional methods of mental health care therapy and medication management, because that's typically what you are given. That's like your first, what did you call it at first? I don't know, we mentioned it yesterday.
First intervention.
Yes. But we are also here as well. So it is an FDA cleared treatment method. It's non-invasive. So what it does is once you put this helmet on, it's literally just a helmet that you put on. And through that helmet, we're sending magnetic pulses to stimulate those areas of your brain that control your mood and your behavior. And with this technology, we're able to treat depression, anxiety, PTSD, OCD, and also smoking cessation as well. And with this treatment method, we are able to target deeper areas of your brain, but also larger areas of your brain as well. So as opposed to the other types of TMS, so there's RTMS, which is repetitive transcranial magnetic stimulation. That is very precise targeting, whereas with our helmet, which will be on the next slide, you'll see how it's almost all-encompassing, almost. And so during the session, you just sit in the chair, you put the helmet over your head, and then our TMS operator will start the machine. And what it feels like is just tapping on the outside of your head. It is not shock therapy. It seems scary. It's not scary. It's no pain at all. Like I said, it's non-invasive. But that treatment, it typically spans for 2 months, and it's 5 days a week. The reason why it's 5 times a week is because to be effective with what we're doing, we need to be consistent with it, because we're trying to go in and improve the neuroplasticity in your brain. Each session is only 15 to 20 minutes though. So it's a very short amount of time out of your day. So it's not like you have to come in and, wait to be seen and then do the treatment and then wait again. It's just you're in and out, and then that's it. There's no, after you finish a treatment session, I know sometimes you're asked to sit down and wait, because it happened to me actually. I got a shot and they told me to sit down for like 15, 20 minutes. And I was like, I'm fine, but they had to make sure. For us, you're good to go. Deep TMS does not require hospitalization or anesthesia either. So it's a very, like I said, non-invasive procedure. And after you do your treatment, you just go back to your daily routine, whatever you're doing afterwards. So this is just, I know you had that question earlier about like what's going on inside the helmet. This is just a, I guess, behind the scenes look of what's going on and how the helmet is wired. I don't know if Dr. Jordan wants to explain a little bit about the coils and what's going on in there.
Well, for our level of understanding, we can keep it pretty brief. I mean, so the first H1 coil and the premise behind DTMS is that we have multiple avenues of magnetic fields that we can stimulate different parts of the brain, because they know that as currents run through and create electric magnetic fields, it creates polarization parallel to the underlying nervous structure. So the different parts, as we see with the H1 is set for the dorsolateral prefrontal cortex, which for layman's term, all we have to think of is the forehead. And so as you see, there's double reinforcement in the coils around that area because they're trying to target it. The H7 coil is something that we look at the parietal lobe, and that's located right above the auditory sensation. And that's the lobe, that is the picture where you see it on the side bilaterally. So it stimulates both parts of the brain. And then the H4 coil is for smoking cessation. And that targets multiple parts of the executive functioning cortex. So as you see, based off the picture, the coils run anterior to the brain, but they do not run in the same pattern as the H1. And that is mainly to target the smoking sensation or smoking addiction, essentially.
Wow, that's so precise.
And you can also see that like in all of these quotes, there's a place where it almost overlaps for each of them. So regardless, there's no way that this helmet can harm you, right? So like some of our patients will also come in and, you know, they'll get a diagnosis for depression. Let's say they're getting the treatment for that, but they might be going through something else as well. Like they might not be able to sleep, or, you know, they might be a smoker. But then some of them finish, you know, their treatment and they're like, oh, hey, by the way, like I slept better, or I stopped smoking. We don't market for that. But there is like a sign, because you can see like the overlap. There's something that's going on, like like inside the brain through this treatment. And then Dr. Jordan mentioned earlier that like in Europe, where they also have this technology, like they're using this over there for Alzheimer, and like they're putting children, like young children, in the chair or like under the helmet. But over here, it is only FDA approved for 18 and over.
Oh, okay.
Yes.
Yeah.
So I went over this a little bit already. So I'm going to skip this. But the only thing I want to take away from this slide is how it feels. I know I mentioned already, it's just like a tapping sensation on the outside of your head. So it's 2-second pulses, what we're doing with the magnetic stimulations, just 2-second pulses. And I believe it's a 20-second break in between. And you're just doing that for the entire treatment session. That's it. Patients are provided with the mouth guard or earplugs, just depending on, you know, if they might have a reflex in their jaw or if the machine is loud for them. I know that you got the demo as well. So did you want to speak about your experience on what it felt like?
Oh, sure. No, that's okay. Yes, it's me, Michelle. The reason that I wanted to come and talk more to Katie's Way about this treatment is because I'm just blown away at what technology can do. And especially if there's options that don't necessarily have to include medicine, or could fortify medicine and therapy. I just think that that's amazingly brilliant. And the team here is just so great and welcoming. And so I came to an event, a veterans event that was here, and they were doing demos. And so, yeah, I went in the chair. I was not knowing what to expect. It was definitely a different feeling, you know, and it does kind of make your jaw move a little bit. So I personally have, sometimes I need a bite guard because sometimes I grind. So I don't know if that was why it kind of affected me a little bit more, but it didn't. When I say affected me, I just noticed it. It definitely feels like something is happening, but it's not scary. The team here was amazing, and they made sure that I knew that they were right there if I need anything, but it was a great experience.
Thank you. So you mentioned that, you know, did you say your jaw? Well, something was switching, right? Like you had a reaction when you sat in the chair?
I felt the jaw thing happen. So I was like, oh, maybe a mouth guard.
Yeah, so like for the first appointment, we do like a brain mapping appointment. So I don't know how to explain it. So we were over there, and basically, you know, you're supposed to, there's a brain cap that goes over, and on there, there's like specific, like there's grid coordinates. And because everyone's brain anatomy is different. So with that cap, our TMS tech is able to, you know, like position the helmet so that for your brain anatomy, it's actually targeting that area that it should be targeting. Because remember in the previous slide, we showed like the coils and like which area it's supposed to affect. That just helps us know like, okay, this is where like we're impacting like the stimulation, right?
So that first appointment, it's like a scan, like a brain scan, or is that kind of what happens? Or?
Yeah. So essentially, what we're doing in these situations is we're targeting the motor cortex, so we can make sure that we're matching the stimulation with your brain anatomy, because that's what's important. Since every brain is different, we need to make sure that we have an individualized treatment towards you. And so the motor cortex is essentially what causes your body to move on the dominant side. And so we trigger that part. Then once we have that anatomical structure, we can say, okay, based on general anatomy, we move this many centimeters forward, we're going to be in the dorsal prelateral frontal cortex, which is mainly our target for treatment. Now, sometimes with DTMS, since it is such a wider field for stimulation. It affects multiple parts as well. And that's one of the benefits of it, is because the difference between repetitive TMS and DTMS is that it has a wider magnetic field. So RTMS, repetitive transcranial magnetic stimulation, is more, if you would want to think of like a figure 8 coil. So just think of like a giant metal sponge. So it is very precise in certain parts of the brain, but it doesn't penetrate very deeply, but it also hits certain targets very well that are very superficial. But the issue is that there's a lot of inter-operator variability, meaning the person who's controlling it can change the course of treatment. DTMS kind of eliminates that just because of the helmet, and it allows anybody who has any limited training can hit the same target every single time. And we see that in our rates of remission as opposed to RTMS versus DTMS. We see that there's higher remission rates in DTMS as opposed to RTMS in depression and OCD and PTSD.
So you mean that with the RTMS, it's more likely that they will need more treatment? So one of the ways that they got around with the RTMS is that they have a new protocol that they call the Saints protocol. And so the Saints protocol is an accelerated RTMS protocol. And all that means is that they change the number of pulses and frequencies that you get per day. So the Saints protocol is currently something that's being investigated by the FDA, just because the preliminary studies have shown remarkable improvement. Now, the big caveat of the Saints protocol is that it's 5 days a week, but you're in clinic for 10 hours a day. And so you're getting approximately 7 months worth of treatment in a week. So the other big caveat associated with this, to answer your question, the big difference between RTMS versus DTMS is that the Saints protocol uses what we call fMRI. So that is a magnetic resonant image of your brain. So they take it for each individualized patient, and they can target specifically. So they're not guessing anymore. So they're saying, this is the person's brain. This is the target. This is where we need to hit every single time. And so that's shown to be extremely effective. It's just that fMRIs are extremely expensive and rarely covered by insurance. DTMS, since it has the helmet, as you just saw, eliminates that because it gives you stimulus deeper and wider than RTMS. Okay. So that is the big caveat of it. Now, there are accelerated protocols that you can do with the DTMS to be on the same level as the Saints protocol. It's just that we're evidence-based, and we just have to wait for the evidence to come out for it to be FDA approved to support it. So we have a theory that it will work because it works in other patients, but we don't like to put, the cart before the horse type situation. So that's where we're at right now. Okay.
So all of our patients that come in do the intake assessment. That's when they sit down and they're like, okay, we do a bunch of screenings, and then we figure out from there, okay, so what's going on? What's the diagnosis? And are you a good candidate for TMS, or should we start you with medication? Are you currently on any medications? Just getting the history, just talking to them, just figuring out, okay, what's going on and how can we help you? Just basic as that. Yeah. So which brings me to my next slide. So if they are a good candidate for the TMS, this is typically their treatment plan. So the first month, so 4 weeks, it'll be 5 treatments per week. So that's every day, right? Monday through Friday. Ideally, of course, we understand that life happens, right? I understand when I brief, I tell everyone it's okay. Me, I typically brief the military population. So I let them know hey, if you can't come in, just communicate with us. We're here to help you help yourself, right? We're not, that's just what it is. But 5 treatments, 4 weeks. And then afterwards, for the following weeks, you start to taper out. So you only do 2 treatments a week. So we ask for that commitment, as I said, because we're trying to improve the neuroplasticity inside your brain. So for it to be effective, we have to be consistent with it.
And that one, yours is not 10-hour days.
No, it is only.
It is not. It is not.
It's 5 days, or it's every day, every weekday.
Yes.
Okay.
Yeah.
But it's 20 minutes per call.
Yes.
Yeah, it's very quick, and that is the caveat.
Yeah.
And then this is just how deep TMS compares to the other treatment methods that are out there.
Okay.
So versus antidepressants, as you know, medication comes with a lot of side effects, right? Every time you start a new medication, there's probably a side effect that comes with it. Someone has told me once that they took a medicine cocktail. So like they have to go through so many different medications. I've talked to somebody who said they've tried every single medication out there, and that was like they were on their last medication, and there was no hope. Like, you know, they were frustrated, and it's valid to feel that way because, you know, you're trying everything, nothing's working for you, and now you're dealing with all these side effects. So for us, we have little to no side effects. The most you might feel is a mild headache because you're not used to that sensation, like the tapping sensation on your head, but afterwards you're completely good to go. And typically it subsides after your first few sessions because you get like acclimated to that feeling. So versus therapy, what I say is that, or what I've encountered is typically, or not typically, sometimes in some situations, people don't like to talk about what they've gone through, right? Because you have to sit down and face it. You're like, okay, this is what I've gone through. But that also puts you into a situation where you have to revisit the situation, keep bringing it up over and over again. I know on its own, that is like a method, you know, exposure therapy, I believe, or just different types of therapy methods. But sometimes it doesn't work and you just don't want to. So having an alternative option out there that you know exists could be beneficial. And then ECT. So ECT, you have to go under the anesthesia, but for us, you don't have to do that, right? So for us, it's an outpatient setting. You just go in, there's no procedure or anything. You just put the helmet on. The only thing that you're going under is the helmet. But for ECT,
What is that?
ECT is more what we think of the traditional sense when we think of old hospitalizations, and this is electroconvulsive therapy. So this is something that has progressed through the years, and believe it or not, this is one of the most effective treatments in medicine.
Really?
Now, the caveat associated with that is that the patient population that it works for is very specific, meaning most people who are not in an inpatient hospitalization setting or acutely suicidal wouldn't even be candidates for ECT. And so with ECT, the big things is that it has to be done in a hospital. It's normally sessions of at least 5 times a week for the first few weeks, and then they transition it to 2 to 3 sessions later on. And you have to have anesthesia, which is why it requires being in a hospital setting. And essentially, it is inducing a seizure-like episode or response in your brain that induces large episodes of neuroplasticity. So TMS actually works on a similar premise of it. It is just a lot safer and a lot more effective when it comes to it. Now, like I say, if you are the appropriate patient for ECT, we have no issue referring you there. And those are mainly patients with depression with catatonia, or some patients who are pregnant and with psychotic features. ECT is extremely effective. And so there's a place for everything in medicine, and that's the way we found it. But it is something here that is a little bit more a burden on the patient, and is a different patient type that we have to worry about. So the other parts of it is that it is associated with a lot of memory loss. That is a big part of ECT. A lot of patients do have some cognitive difficulty initially and after the session. Sometimes it resolves, sometimes it does not. But it depends on the patient, but also you wouldn't be in that situation if we didn't need that high level of treatment.
Right. I think it's worth the trade-off.
It's kind of like how I explain to patients, like, you wouldn't need surgery. And obviously the best treatment is not surgery if it's not that situation. So it is the trade-off that you make in medicine, and it is one of the tools that we have in our toolkit, but it's not something we use. And we feel that Deep TMS is a better modality overall.
That's fantastic.
So just going over some benefits of Deep TMS. So it is an effective, I cannot say this word, non-pharmacological.
Non-pharmacological, there you go.
So basically no medication, right? For those who want an alternative to mental health care. Right. So it's also safe for mothers who are breastfeeding, because I know that there's a concern there as well, but also pregnant mothers. So if they're, expecting, they can still go through the Deep TMS treatment, and it's completely safe for them. There are no long-lasting side effects, as I mentioned before. I already went over that. I don't want to repeat it. So just to go over the statistics, right? So, sorry, did I cut you off?
No,
oh,
you're good.
So for just some statistics, so I know we mentioned the RTMS and then the Deep TMS. So this is just a comparison between the two with RTMS and medication. So RTMS medication is 44, but for us, we're at 67. Whereas medication alone only has a remission rate of 11%. But when you combine medication and the Deep TMS, it jumps up to a 60% remission rate. And these statistics are based off of BrainsWave, which is the manufacturer of the technology.
Study they did.
So this is an industry-sponsored trial. The big thing that they did, and important information to kind of take away from this, is a lot of this is they take the definition for this and response rate for what we would call treatment-resistant depression, and that's based on a study called STAR-D, and that's the big, huge study that essentially saw patients with depression and saw how many medications they were on and their chances of response. And so one of the big takeaways from the study is any patient who's taken over 4 or 5 medication, their treatment response falls to less than 10%. And that means there's nothing that's going to help this subset of the population.
Does that mean taking all of the medication, like 5 at a time?
No, it just means that they failed 5 medications. And when we talk about treatment failure, there's all sorts of things that mean treatment failure. So that means that normally therapy is involved, so they weren't a good therapy candidate, they didn't benefit from it. Or if they took a medication, they were on the appropriate dose and they didn't have the response. Or if they were on the appropriate dose, they had too many side effects and the medication was more detrimental than helpful. So that's what we consider a treatment failure. So the important part of this, and this is all leading up to a point, is that these studies were done on what we consider treatment-resistant patients. So those are the patients who had failed 4 to 5 medications.
Those are like
so these, so these are not your patients who are, haven't tried anything, just walked in off the street and said, "Hey, I'm feeling a little depressed." It's like, no, these patients have been through the system and have been failed by the medication and sometimes a therapy option as well. And so they're looking for all sorts of modalities. And that's why you see this number is so low, because it's just like after this certain point, the statistic from STAR-D is like, say, 10 to 11%. So your chance is if you have 10 patients like that, one of them's going to respond, as opposed to, which is not very helpful for a patient, as opposed to when you see it with DTMS, you see that this treatment is 67. So it's like 2/3% or, close to 6 to 7 out of 10. It's a pretty good improvement from 1 out of 10.
For sure.
And RTMS, not to be, left in the dark, we appreciate the different modalities that are available. It was 44% with the medication. And that's nothing. That's better than 1 out of 10,
That's right.
4 out of 10. So there is hope. That's what this is meant to say. It's like we have different avenues that we can help treat with. And there is no direct comparison between DTMS or ECT, which we talked about a little earlier. But I imagine the ECT response rates are in the 80 to 90% range. So those are 9 out of 10 of those patients. But as we mentioned before, there's lots of side effects associated with it. And it is a much higher level of care, because when you're in the ECT range, you've been hospitalized, you've failed multiple medications. This is what we wouldn't consider a first line intervention, a second line. This is more 3rd or 4th line. So it's very far down the list as far as interventions.
It's so aggressive.
It is very aggressive, but it works if you need it.
Right. I know. That's amazing. I don't know if now's a good time to ask, or maybe we can go. I just want to pin this one because you all are here. We're here in El Paso. This is Katie's Ways. Have been here for how many years? 3 years?
About 3 years.
3 years. And, all of this stuff sounds great, but what I'm excited about us getting into is how you're getting a new machine because of the demand.
Oh, yeah. So
So I don't know, now's a good time to
Well, so we're going to introduce you to our resident superstar right here, Brandy, and she can tell you how she made the magic happen.
Make it happen, girl. No, but it's exciting to me because that is just like, that's right here at home. Obviously, you're making a difference. So, hi, Brandy.
Hello. So I'm Brandy. I'm the facility director here at the El Paso location. So yeah, we have actually received our machine. We have our machine. We're gonna start some construction here so we can start making some movements and we can start seeing more patients. It quickly, escalated to such a surplus of patients, needing help, and we have a thing here where we don't leave anybody behind, and we always see anyone who comes in through the door, whether it's here or they need help somewhere else, and we'll definitely, welcome everybody and make sure that they get the help that they need no matter where it's at. So with that being said, we, just have been working a lot on expanding our outreach and getting the word out there about, the services we offer and how we can help and anybody in the community. And so we now have a wait list. So, we have patients, a few patients waiting for us to get the machine up and running. So we're going to be doing that hopefully next week.
By the time this comes out, we hopefully will not have a wait list.
Yes,
And-
right.
So, and just
and I'm saying Brandy's being very modest on what she's done,
Okay.
along with her and Kristina as well. Because when they first took over the clinic, I believe we were seeing one patient a week, and now how many patients a week are we seeing?
we're seeing about 60 patients a week.
So she brought the clinic from one TMS to about 60. So it is quite a turnaround.
That is
And-
incredible.
and it is-
And just like when I met you, like your passion and belief and like, your presence about what
Yes.
this is doing for people.
Because that's one thing we do want you to take away from Katie's Way, is that our philosophy is that we want to revolutionize mental health care, but also we want to, as they say, leave no patient behind. And the team here every team member that I met is extremely passionate about the mission. I mean, to the point that they're working longer hours than they need to.
Yeah.
They're always thinking about how they can benefit their patients in every aspect. So it's a rare culture that we build to make sure that we are making sure the patient gets the best care possible. And that's just not to toot our own horn. That's literally our motto. That's what we want. So if we strive to reach that with all the patients, and especially in the El Paso location, one of the things we're looking for is also another location so we can better help the community as well. And then expanding services, such as you talked about, creating more telehealth providers, bringing in more therapists, because we also were able to bring in therapy, and our therapist was able to be fully booked in about a month. So we recognize there's a huge mental health need.
Yes, there, yeah.
And so that is something we are bringing forth. And also Brandy is working with us to bring in also bilingual providers as well to help reach all communities in the El Paso area. So she's one of our resident superstars, along with Kristina as well. So I'll let them take back over.
This is accepted. I know I owe you the slide deck so that they'll actually be able to see.
Yes,
the list.
yes.
And then just who we serve. So like I said earlier, the military community, everyone. So that's also including dependents, children who are 18 and over, of course, service members, retirees, veterans, everyone in the military community, and then of course civilians as well. And as Brandy mentioned, we will never turn anybody away if they need help. And I know on our door it says 8 to 5, right, that we're open Monday through Friday, but also we could, depending on the situation, like if a patient calls us and they say, hey, I won't make it by 5 o'clock, could you stay open until 6 o'clock when I can come in? Brandy says all the time that mental health care doesn't stop, right? Like if you're calling us and you're saying like, hey, like I won't make it, but like I really want to come in, like we are going to be here for you. Right.
See, that's lovely.
Right now we have our one TMS tech who operates the machine, but the majority of the staff members here in the clinic are certified to operate that machine as well. So if he can't stay behind, somebody else will be here to take care of that patient. And it's all about just patient care, being here, like to serve the community, serve everybody, right, that needs help. And I mentioned to you outside as well that it's not just about the mental health care and like giving you the treatment, but it's also providing you with the resources or connecting you with the correct organizations to make sure that you're taken care of everywhere else. Because you might, be going through a mental health issue, but what's the cause or what else is going on behind that, right? Like, are you struggling financially, or do you need food? Do you need, I don't know, anything, right? That's exactly what I'm here for, is to help find these resources and bring them to the patient. And when I say that, I don't mean like, here's the flyer, like good luck. I mean, like, I'm going to connect you to that other organization, a direct point of contact, like, hey, and I'll follow up. So I'll be like, hey, did you call or did they call you? Whichever. What's, because it's based on their what they're comfortable with. Like, do you want me to give you their information or do you want them to reach out to you? And we'll just go out from there. But yeah, just providing those resources and making that direct connection for them is really what's important, because we want them to know that they're taken care of, like, all the way around. It's not like, oh, you come into our clinic, you get the treatment and you're done. Like, you're not, you are a person and you deserve those services, and you deserve, I don't know, high quality care just the entire way through.
Correct.
That's exactly what we're here for. So
that is a Katie Way model, but I think El Paso best embodies it.
Yes.
I mean, because like I say, we're at so many different locations and so many different team members. This is the clinic where I've met the majority of team members who are committed to that mission as well. Not saying the other clinics are, but they embody this specifically. So it is something that we try to meet with every single patient and see how we can best help them. That's something that we want to look at too, is if we don't have the resources for you, we want to send you to a place where they can support you as well. Because the goal is to get you care. Even if we don't make any money, we're fine. We just want to make sure you're taken care of.
And how long have you both been here?
I have been here since November of last year.
What? You grew 60 patients in that amount of time? Whoa!
Yes, ma'am.
That is impressive.
I mean, that's impressive.
That is very impressive.
Wow. And how about you, Kristina?
I've been here since February.
Since this February?
Yes.
Okay, so I think what excites me about hearing that is that that embodying the no patient left behind, like when that service, and healthcare, especially in El Paso. I don't want to say especially in El Paso. I want to say that, but I've noticed that a lot of places don't have that mentality, and I just think that speaks to how being of service. That's how you grow community and build business. Is because people are like, I want to send people here.
Yeah.
Because they're like, these people actually care. I'm not just a number.
Yeah, and it all also comes down to, here in El Paso, there's a lot of resources out in the community. There's a lot of people that can help out in the community, and people will come together, but it takes the actual initiative of taking that first step and doing the outreach, and the education is a big part of it too, is outreach, and then educating people about how can I help you. And it's not about, hey, how can I make more money? It's how can I help you, because that's what it is basically. You know what I mean? We're here to save lives, and that's what we're here to do, is to educate others. So
a little bit earlier, but I started here February of this year, but towards the end of the month. But at the beginning of the month, I was actually still active duty. I ETS on February 6th, and I started here February 24th. So 2 weeks after I got out. But because of, what I saw, like when I was serving, I saw the need for the mental health care, and like I have a passion for that. And before I got out, I was a platoon sergeant, so I led 40 soldiers. And so every day it was just like, hey, Sergeant Q, like I just want to talk to you, like I just, I just wanted to help them, right? Because all of them, I thought of them as like kids. I'm only 24, but it was like I had 40 kids. So just like they would come up to me and just talk about like their personal lives or what's going on here, and like having this resource. If I knew that this resource was here, like when I was in, I definitely would have sent them over here, right? And right now, because there's like, they don't need the referral to come in, because that waiver is in place until June 30th for the active duty service members. But because that referral is taken out of the way, they don't have, it's a barrier that's taken away. So it's easier for them to receive that care. But my why is because I saw the soldiers and I needed the help. I know some of them needed the help too. And now being on the other side, like I want to continue serving and helping them, but also helping the civilian community as well. Because here in El Paso, we are all very interconnected, and we say that we are the veterans capital of the country. So that's exactly why we're here. We want to just help the community.
Actually, originally I'm from El Paso myself. I moved to Colorado about 7 years ago. Recently went through a divorce and moved back to El Paso because my family is here. During my separation and divorce, I struggled a lot with my own mental health issues as well. I also back in Colorado, worked with kiddos, with mental health issues as well. And I think that's where everything just sparked my interest in mental health. So then coming here and having that experience there and then also going through it myself, it just ignited something in me that, I never really actually sought for help myself in the past. I had a lot of hindrances that just never allowed me to actually seek for help until now. So then once I went through it, got the help that I needed and, saw the difference in not only myself, but my peers around me, my kids, my family. One never really notices how much mental health on one person can impact those around you and your environment. Sometimes we don't think about those things when we're going through it. It's just, we think about how is it affecting me, not those around me. And so I think that was my biggest drive, to be able to be in the mental health field and be able to advocate for mental health and help others, just pass through storms that I have been through. So, yeah.
That's awesome. All right. Okay. And yeah, Chief, how did you end up with the?
All right.
And
Well,
you're the Chief Medical Officer.
I am the Chief Medical Officer for Katie's Way. I am Dr. Jordan. I am board certified in both neurology and psychiatry. And Katie's Way actually found me. So I was on academic faculty in the Northeast, and I was very involved in doing research, studying neuromodulation, which includes DTMS, RTMS. And I heard about this clinic that gives the opportunity. The primary modality is neuromodulation, but also the fact that they work with the veteran population. And it was something that always interests me. I personally did not serve, but I have several family members who have served and been in the military, and I know how underserved the community is. So I was approached by Jeff Mathis, our CEO, and he essentially convinced me to, this is where I wanted to be. So I ended up moving.
How long have you been with me?
So I've been coming on about a year and a half right now. So I moved from Boston, Massachusetts to our Austin, Texas, and I go up to our corporate office in Kansas City, Kansas City, Missouri. I'm sorry. There's two of them. And so one of the things, and the thing that has impressed me the most about Katie's Way is the motto, and the thing that drew me to it is the fact that they wanted to revolutionize mental health care, because that was something that was so important to me. Because my way and the way that I operate is that as a physician and provider, it is our goal to provide care. And meaning, if we don't know about it, the patient's not going to know about it. And how can we say we're offering the best if we're not on top of it? And so this kind of challenged me to live to that model in everyday life. And also being able to provide care for those who directly defend our country is a big honor as well. And it's not something we take lightly as well, but we also treat civilians. So tying into that, and then also the research opportunities associated with Katie's Way is something that we really haven't discussed, but one of the things that we want to get into, since we are concerned about innovation, is how can we make more treatments for our patients. So our goal is to create our own protocols and be involved in several FDA trials to bring new things to the market to better help these patients. So all those things, and just my passion and care for taking care of people, because I'm a physician after all. I went into medicine because I care about people and want to make sure that we take care of everyone as we go through life. Because my whole motto is that I want to leave the world better than when I came. And so Katie's Way has definitely given me that opportunity to definitely leave a positive imprint on the world.
So, Dr. Jordan, Brandy, and Kristina, and a whole team of others out there helping the people right now. Thank you so much.
Yes,
for
thank
sharing this
you.
with me and with the El Paso community. I really appreciate you all.
We
We hope
appreciate
to
it.
see you soon.
Yeah.
Thank you.
Thank
See
you.
soon.
Yes.